Welcome to the Inside the Boards Study Smarter series dedicated to helping you learn to think like a question writer so you can study smarter, not harder, and succeed on your exam.
Hello, everyone. It's Patrick Beeman, your host. This is an episode in our Step 2 and Shelf Exam Study Smarter series. Inside the Boards, it's high yield med ed for free. Here we go.
Hi, I'm Ted O'Connell, author of USMLE Step 2 Secrets and Chief Content Officer for Inside the Boards. This is some of the high-yield content from Step 2 Secrets in audio format so you can study on the go and get back to reclaiming some of your life. Why is the duration of symptoms important with psychosis? The time frame is important because given the exact same symptoms, a patient is given one of 3 different diagnoses based only on their duration. Less than 1 month is acute psychotic disorder. 1 to 6 months is schizophreniform disorder. More than 6 months is schizophrenia. List the positive symptoms of schizophrenia: delusions, bizarre behavior, hallucinations, and thought disorder, such as tangentiality and clanging. Positive symptoms are symptoms that occur in addition to normal behavior. Normal individuals do not exhibit these symptoms. Positive symptoms respond well to all currently used antipsychotics. List the negative symptoms of schizophrenia: flat affect, anhedonia, alogia, which is no speech, poor attention, avolition or apathy, and asociality. Negative symptoms are symptoms for which patients have lost some form of normal behavior. They have lost behaviors that normal individuals typically have. Negative symptoms respond poorly to traditional antipsychotics, such as haloperidol, but may respond to atypical agents such as risperidone, olanzapine, aripiprazole, paliperidone, quetiapine, or Trazadone. What is the difference in age of onset for schizophrenia in males and females? The typical age of onset is 15 to 25 years for males. Look for someone going to college and deteriorating. And 25 to 35 years for females. Differentiate among the classes of antipsychotic drugs. The prototype high-potency drug is haloperidol. It has a high incidence of extrapyramidal side effects, a low incidence of autonomic nervous system side effects, works well for patients with positive symptoms, and works poorly for patients with negative symptoms. The prototypical low-potency drug is chlorpromazine. It has a low incidence of extrapyramidal side effects, has a high incidence of autonomic side effects, works well for patients with positive symptoms, and works poorly for patients with negative symptoms. And then the atypical agents, including risperidone, olanzapine, aripiprazole, paliperidone, quetiapine, and Trazadone. It should be noted that the atypical newer antipsychotics are generally first-line treatment and maintenance therapy due to reduced extrapyramidal side effects and efficacy with negative symptoms. Generally choose them over older agents. So these atypical agents have a low incidence of extrapyramidal side effects, a medium incidence of autonomic nervous system side effects. They work well for patients with positive symptoms and work fairly well for patients with negative symptoms. What are the 4 commonly tested extrapyramidal side effects of antipsychotics? Acute dystonia, AKAthisia, Parkinsonism, and tardive dyskinesia. Define acute dystonia. How is it treated? Acute dystonia is an extrapyramidal movement disorder that occurs in the first few hours or days of treatment. Patients develop prolonged muscle spasms or stiffness, such as torticollis or trismus, tongue protrusions and twisting, opisthotonos, and or oculogyric crisis, which is forced, sustained deviation of the head and eyes. Acute dystonia is most common in young men. Treat with antihistamines, such as diphenhydramine, or anticholinergic drugs, such as benztropine or trihexyphenidyl. Define akathisia. Akathisia occurs in the first few days to weeks of treatment. The patient has a subjective feeling of restlessness and may pace constantly, alternate sitting and standing, and be unable to sit still. Beta blockers can be tried for treatment. Describe the relationship between antipsychotics and Parkinsonism. Parkinsonism usually occurs in patients taking antipsychotics within the first few days to months of treatment. It is thought that Parkinsonism develops because of dopamine depletion, but that psychosis develops because of too much dopamine in the brain, which is a gross oversimplification. Thus, antipsychotics create an iatrogenic decrease in effective dopamine in the brain by blocking dopamine receptors. The patient develops stiffness, cogwheel rigidity, a shuffling gait, mask-like faces, and drooling. Parkinsonism is most common in older women. Treat with antihistamines, such as diphenhydramine, or an anticholinergic agent, such as benztropine or trihexyphenidyl. What is neuroleptic malignant syndrome? How do you recognize and treat it? Neuroleptic malignant syndrome is a life-threatening condition that can occur at any time during antipsychotic treatment. Patients classically develop lead pipe rigidity, tachycardia, profuse diaphoresis, mutism, obtundation, agitation, a high fever of up to 107 degrees Fahrenheit, very high levels of creatine phosphokinase, more than 4 times the upper normal limit, sweating, and myoglobinuria. Treat first by discontinuing the antipsychotic, then give supportive care for fever and potential renal failure caused by myoglobinuria, primarily intravenous fluids. Lastly, consider dantrolene, just as in malignant hyperthermia, which is thought to be a similar condition. Describe the relationship between antipsychotics and prolactin levels. Dopamine blockade causes increases in prolactin levels because dopamine is a prolactin inhibiting factor in the tuberoinfundibular tract of the brain. The end result may be high serum prolactin levels, resulting in galactorrhea and impotence, menstrual dysfunction, and/or decreased libido. What are the classic side effects of thioridazine and chlorpromazine? For thioridazine, it is retinal pigment deposits. For chlorpromazine, it is jaundice and photosensitivity. Define bipolar disorder. What are the classic symptoms? Mania is the only criterion required for the diagnosis of bipolar disorder, but a history of depression is classically present. Remember the mnemonic DIG FAST for classic symptoms of mania, which include D for distractibility, I for insomnia, G for grandiosity, F for flight of ideas, A for agitation, S for sexual promiscuity, and T for talking with pressured speech. Look for initial onset between the ages of 16 and 30 years. Question 24. What are the side effects of lithium, valproic acid, and carbamazepine? For lithium, it includes renal dysfunction in the form of diabetes insipidus, thyroid dysfunction, tremor, and central nervous system effects at toxic levels. For valproic acid, it is liver dysfunction, tremor, and gastrointestinal distress. For carbamazepine, it is bone marrow suppression, diplopia, ataxia, agranulocytosis, aplastic anemia, SIADH, and Stevens-Johnson syndrome. List the major risk factors for suicide. Age greater than 45 years, prior psychiatric history, alcohol or substance abuse, depression, history of rage or violence, recent loss or separation, prior suicide attempts, loss of health, male gender. Men commit suicide 3 times more often than women, but women attempt it 4 times more often than men. Unemployed or retired status, single, widowed, or divorced status, access to weapons, and an organized plan. Define depression. Depression, or major depressive disorder as it is technically called, is defined by the DSM-5 as a depressed mood or a loss of interest or pleasure in daily activities for longer than 2 weeks. There is impaired function in social, occupational, or educational roles. At least 5 of the following 9 symptoms are present nearly every day, and one must be either depressed mood or decreased interest or loss of pleasure. These include depressed mood or irritability, decreased interest or pleasure in most activities, significant weight change or change in appetite, change in sleep, change in activity, psychomotor agitation or retardation, fatigue or loss of energy, guilt or feelings of worthlessness, diminished ability to think or concentrate, and suicidality. How do SSRIs work? Why are they preferred over tricyclic antidepressants? SSRIs such as fluoxetine, citalopram, paroxetine, sertraline, fluvoxamine, and escitalopram prevent reuptake of serotonin only. They have less serious side effects such as insomnia, anorexia, jitteriness, headache, and sexual dysfunction, and are not dangerous with overdose compared to tricyclics. How do SNRIs work? SNRIs such as venlafaxine, duloxetine, and desvenlafaxine prevent reuptake of serotonin and norepinephrine. The side effects of SNRIs are similar to those of SSRIs, but also include noradrenergic symptoms such as sweating, dizziness, increased blood pressure, and sedation. How do tricyclic antidepressants work? What are their side effects? Tricyclic antidepressants, such as nortriptyline and amitriptyline, prevent reuptake of norepinephrine and serotonin. They also block alpha adrenergic receptors, so watch for orthostatic hypotension, dizziness, or falls. And they block muscarinic receptors, so watch for anticholinergic effects, such as dry mouth, blurred vision, constipation, and urinary retention. They cause sedation, which is an antihistamine effect, and lower the seizure threshold, especially bupropion, which technically is not a tricyclic. Tricyclic antidepressants are dangerous in overdose primarily because of cardiac arrhythmias, which may respond to bicarbonate. Remember the 3 C's of tricyclic antidepressant overdose: coma, convulsions, and cardiotoxicity. What are the monoamine oxidase, or MAO, inhibitors? Describe their side effects. MAO inhibitors, such as phenelzine and tranylcypromine, are older medications that are not used as first-line agents for treatment of depression. They may be good for atypical depression. Look for hypersomnia and hyperphagia, the opposite of classic depression, that fails to respond to other agents. When patients taking MAO inhibitors eat tyramine-containing foods, especially wine and cheese, they may get a hypertensive crisis. Do not give MAO inhibitors at the same time as SSRIs or meperidine. Severe reactions such as serotonin syndrome can occur, possibly leading to death. What is the most notorious side effect of Trazadone? Priapism, which is persistent painful erection in the absence of sexual desire that may lead to permanent impotence if not treated. What is generalized anxiety disorder? How is it treated? Patients with generalized anxiety disorder worry about everything, such as career, family, future, relationships, and money at the same time. Symptoms are not as dramatic as in panic disorder. The patient is simply a severe worrier. Patients have difficulty controlling their worries and can have restlessness, fatigue, difficulty concentrating, irritability, muscle tension, and sleep disturbances. Treat with cognitive behavioral therapy and medications, such as SSRIs, especially if depressive symptoms coexist. They can also be treated with buspirone, an agonist of 5-hydroxytryptamine 1A serotonin receptor, which is non-addictive and non-sedating, but has a slow onset of action, or you can treat with benzodiazepines, which are less preferred because they can be addictive and sedating. Give the classic examples of simple phobias. How are they treated? Classic examples of simple phobias include fear of needles, blood products, animals, and heights. Treat with behavioral therapy, including flooding, sudden, intense exposure to the feared object without a chance for escape, systematic desensitization, a gradual increase in intensity and type of exposure until the person is comfortable with intensive exposure to the feared object, and biofeedback, which is learning to control autonomic variables like heart rate during anxiety-inducing maneuvers. What is social anxiety disorder? Social anxiety disorder, also known as social phobia, is a specific type of simple phobia, a fear of social situations, that is best treated with behavioral therapy. To reduce symptoms, beta blockers may be used before a public appearance that cannot be avoided, and SSRIs are increasingly being used as a primary treatment. SNRIs and benzodiazepines may also be used. How do you recognize and treat post-traumatic stress disorder? Look for someone who has been through a life-threatening event, such as war, severe accident, or rape, repeatedly experiences the event through nightmares and flashbacks, and tries to avoid thinking about it. Patients can also have dissociative amnesia of the event, irritability, recklessness, or self-destructive behavior, depression, and poor concentration. Treat with peer group therapy. If you have to choose a medication, use an antidepressant, usually an SSRI. Note that post-traumatic stress disorder must have symptoms for longer than 1 month. Symptoms for less than 1 month indicate acute stress disorder. How do you recognize dissociative fugue, also called psychogenic fugue or fugue state? Dissociative fugue is a reversible amnesia for personal identity, including the memories, personality, and other identifying characteristics of individuality. It usually involves unplanned travel or wandering. There is complete amnesia for the fugue episode. The classic patient develops amnesia, travels, and assumes a new identity, but does not remember the event upon returning. Question 53. What psychiatric disorder is most likely to be associated with childhood sexual abuse? Dissociative identity disorder, personally known as multiple personality disorder. Define obsessive compulsive disorder. How is it treated? Obsessive compulsive disorder, or OCD, is marked by recurrent thoughts or impulses, obsessions, or recurrent behaviors, compulsions, that cause dysfunction in the occupational or interpersonal life of affected individuals. Look for washing rituals, such as washing the hands 30 times per day, or checking rituals, checking to see if the door is locked 40 times a day. The obsessions or compulsions are time-consuming or can cause distress. Onset is usually in adolescence or early adulthood. Treat with SSRIs, especially fluvoxamine, or with clomipramine, a serotonin-specific tricyclic antidepressant. Therapies such as cognitive behavioral therapy and flooding may be effective. True or false? Some psychiatric patients can be hospitalized against their will. True. Patients can be hospitalized against their will if they are a danger to themselves, that is, they're suicidal or unable to take care of themselves, or if they're a danger to others, that is, homicidal. How do you recognize autism spectrum disorder? Autism symptoms start at a very young age, beginning as early as 6 months and becoming well established by 2 or 3 years. Look for impaired social interaction, which is isolative or unaware of surroundings, impaired verbal and nonverbal communication, such as strange words, babbling, or repetition, and restricted activities and interests, such as headbanging or strange movements. Autism is a spectrum of disorders in which patients may range from highly functioning, it was previously called Asperger's syndrome, to severely intellectually disabled. Most individuals with autism manifest some degree of intellectual disability that is typically moderate in severity. No single cause has been identified for the development of autism. Genetic origins are suspected on the basis of twin studies and a higher incidence among siblings. Possible contributing factors include fetal alcohol exposure, infections, other perinatal factors, and immunologic causes. Define conduct disorder. With what adult disorder is it associated? Conduct disorder is a pediatric form of antisocial personality disorder. Look for fire setting, cruelty to animals, lying, stealing, and/or fighting. As adults, patients often have antisocial disorder. Note, evidence of conduct disorder as a child is required for a diagnosis of antisocial personality disorder in adults. How do you recognize anorexia? The classic patient is a female adolescent who is a good athlete or student with a perfectionistic personality. According to the DSM-5, the criteria for the diagnosis are restriction of energy intake, leading to a significant low body weight, intense fear of gaining weight or becoming fat, and disturbance in the way one's body weight or shape is experienced. Roughly 10 to 15% of patients die from complications of starvation or coexisting bulimia, electrolyte imbalances, cardiac arrhythmias, and infections. Although more positive therapies are preferred, patients sometimes need to be hospitalized against their will for intravenous nutrition. Patients with anorexia may be of a restrictive type, severely restricted caloric intake, or a binge purge type, self-induced vomiting or laxative abuse. Define bulimia. What are the classic findings of the mouth and fingers? Bulimic patients have binge eating episodes during which they feel a lack of control and then engage in purging behavior, such as vomiting, laxatives, exercise, or fasting. Those affected are typically normal weight or overweight adolescent females. If these patients ever meet criteria for anorexia, they are diagnosed with the binge purge type of anorexia. That is, the anorexia diagnosis trumps the bulimia diagnosis. Patients may require hospitalization for electrolyte disturbances. Classic findings include eroded tooth enamel caused by frequent vomiting and eroded skin over the knuckles from putting the fingers into the throat. What is the most commonly abused illicit drug? Describe its effects on users. Marijuana, traditionally, though with changes in marijuana laws, this may be changing. Watch for a teenager who is withdrawn and shows a decline in school performance. Other symptoms include amotivational syndrome. Chronic use can result in laziness and lack of motivation. Time distortion, impaired judgment, conjunctival injection, paranoia, and the so-called munchies, which is eating binges during intoxication. No physical symptoms have been reported for withdrawal, but psychologic cravings may be present. Marijuana is not dangerous in overdose, although patients may experience temporary dysphoria, and is a controversial teratogen. The evidence is weak. What symptoms are associated with cocaine intoxication? How about cocaine withdrawal? Cocaine causes sympathetic stimulation, such as insomnia, tachycardia, mydriasis, hypertension, and sweating, along with hyperalertness and possible paranoia, aggressiveness, delirium, psychosis, or formications, so-called cocaine bugs. Patients think that bugs are crawling on them. Overdose can be fatal as a result of arrhythmia, myocardial infarction, seizure, or stroke. During withdrawal, the patient is sleepy, hungry versus anorexic with intoxication, and irritable with possible severe depression. Cocaine withdrawal is not dangerous, but psychologic cravings are usually severe. Cocaine is teratogenic, causing vascular disruptions in the fetus. Describe the symptoms of amphetamine intoxication. Amphetamines are longer acting and associated more commonly with psychotic symptoms. Patients may appear to be full-blown schizophrenics, but basically their effects are similar to those of cocaine. Describe the effects of opioids. What symptoms are seen in withdrawal? Heroin and other opioids cause euphoria, analgesia, drowsiness, meiosis, constipation, and CNS depression. Overdoses can be fatal because of respiratory depression. which should be treated with naloxone. Because the drug is often taken intravenously, associated morbidity and mortality includes endocarditis, HIV infection, hepatitis, cellulitis, and talc damage. Withdrawal is not life-threatening, but patients act as though they are going to die. Symptoms of withdrawal include piloerection, diarrhea, insomnia, abdominal cramping, and pain. Methadone or buprenorphine can be used to reduce acute withdrawal symptoms. How do you recognize intoxication with LSD or hallucinogenic mushrooms? Symptoms of intoxication with LSD or mushrooms include hallucinations, usually visual as opposed to auditory in schizophrenia, mydriasis, tachycardia, hypertension, diaphoresis, and perception and mood disturbances. Neither is dangerous in overdose unless the patients think he or she can fly and jumps out a window. No withdrawal symptoms or teratogenic effects have been reported. Users may experience flashbacks, which are brief feelings of being on the drug again even though none was taken. This can occur months to years later, or they can have a bad trip, an acute panic reaction or dysphoria, which should be treated with reassurance or a benzodiazepine or antipsychotic if needed. What about PCP intoxication? PCP intoxication causes LSD or mushroom symptoms, plus confusion, agitation, and aggressive behavior. Also look for vertical and or horizontal nystagmus. Possible schizophrenic-like symptoms such as paranoia, auditory hallucinations, and disorganized behavior and speech. Overdose can be fatal because of convulsions, coma, and respiratory arrest. Treat with supportive care and urine acidification to hasten elimination. No withdrawal symptoms have been reported. Describe the signs and symptoms of benzodiazepine or barbiturate intoxication. Benzodiazepines and barbiturates cause sedation and drowsiness, as well as disinhibition and reduced anxiety. They can be fatal in overdose as a result of respiratory depression. Treat acute overdoses of a benzodiazepine with flumazenil, although this may precipitate seizures. In withdrawal, death may result from seizures and/or cardiovascular collapse. Treat withdrawal on an inpatient basis with a long-acting benzodiazepine and gradually taper off the dose over several days. Benzodiazepines and barbiturates are especially dangerous when mixed with alcohol because all three are CNS depressants. That's it for today. A big thank you to Elsevier Incorporated, my publishing company behind USMLE Step 2 Secrets, for allowing us to put out this book in audio format.
Thank you so much for listening. That's it for today. You've been listening to Inside the Boards, the best free audio resource for board prep and med school.